neyanziza ino MC ni management ya church amaina neirobozi Dr. Bameka Aggrey, Obstetrician Gynecologist, attend coordinator wa maternal and newborn health for Busoga region on behalf of Ministry of Health. Ate naba mukwano gwa church eno. This is my second time okuba ku church eno. Ayenze ndije kwogera ku bya bulamu. And it is good nti tuli kwogera ku couples. And being obstetrician and gynecologist, then this is the right place for me. Presentation yange ebaire nzibu ya kukola. But what we shall do, ndakwogera ku like for 15 minutes, then next session ebe more of question and answer. Kubandi dinti mulina ebibuzo bingi oba oli awo byentategeeke mu presentation yange atenga ze neryo kyenalienze muwulire kuko. Ayo okutandika ndakwebaza management okulowooza ku couple meeting sort need to know, because nga ministry obuzibu bwaife obusinga omukazi aida yenka omwami yena yaida yenka, then ono wamuwa information yiye nole wamuwa yiye, and usually kyatufukira kizibu communication no ku facilitating abantu kyababa bali presenting nakyo. Now lero neze kutandika kwogera ku kyetweta maternal death. Maternal death kitegeeza omukyala okufa ng'ekimuyise kyekuusa kukuzaala. Omukyala asobola okuba alibita mu town baamukuba isasi mu mugulu ya bleedinga yafa oba mu mabunda. Ekyo kyandawulo ku mukazi okulumwa n'ayabika n'abaana n'afa. Gwe bakubye isasi me n'afa yo ti maternal death. Kuba eyo accident abeera alibita mu town bali kwekalakasa baamukuba isasi. Ayo n'atwaire olubuto n'ajja mu idwaliro oba n'ajja ewamulerwa n'abaana n'eyabika me n'afa, eyo ni maternal death. Lwaki tubyawulamu? Maternal death eri preventable. Eri accidental death teri preventable by us abasawo. Omukazi afa due to a maternal death, singa ife nga abasawo oba government yongayo oba yo omulwaire nga ye akola kyaliment yokola, buli muntu nakola kyaliment yokola, we can reverse that death. Nsaba abakyaki bawulire ebintu bino bana ife abali wano, because every single day tuluzinga abakazi 16 abali documented. I didn't banji tibali documented, but these 16 bali kufa due to a preventable cause. There are about 6 causes of maternal deaths. Nja kwogera ku bikasinze ebisatu. Ekisooka ngera kyensinze kwenda kwogera ku kyebeta hemorrhage, bleeding nekasinze kuyita. Ekyokubiri high blood pressure. Then ekyokusatu infections. Ti infections dino di UTI. Aye infections olenga azaire me yafuna amasida oba atwaire mu lubuto then yafuna infections. Then kire ekyokuna abortion and abortion complications. Now lero nja kwenda kwogera ku bleeding ey'omukazi nga azaire. Ekasinze kuyita bintu biri bine ebisinga kuyita ebireta bleeding. Ekisooka n'abaana kulema ku contractinga. Ozalire wamulerwa bazze idagala li stopping a bleeding, then wa bleeding paka kuwa mu musaayi. Ate ife abakazi baife mu Busoga n'omukasinze anemia abakazi abasinga mu busoga batambulira ku busaayi butono buti bwe balina saa bleedinga mu giraasi ndala ng'akola pusinga. Kiro ekindi ekireeta bleeding mwana kukuyuza. Then ekindi bintu kulemeramu ozaire placenta ekyeinuma kyasigalamu then n'abaana ya bleedinga paka. Bino tusobola kubiziyiza tutya? One, okukendeza maternal deaths twetaaga ebintu oti bisatu oba bina. Ekisooka kufuna lubuto ng'olwetegekeire. Kiswaze na kudina omuntu okufuna olubuto nga talwetegekeire nga family planning method si diriwo. Dirido ningi eno bwe omulibirigo bwe gulemeru eno tusobola okukulondera ku eyindi. 2, bw'oba ofunye olubuto oba bw'obanga oli mu time efuna olubuto time eyo ogituuka muli kasita oba nga okuba oti oba lwide toli mu family planning okuba oti oba lwide aye toli kulunoonya ino but toli kozesa method then eyo ku time eyo olimenti okujja mu idwaliro mwakola kyebeeta pre-conception counseling. Idea lengo kalitola lubuto olina okudda mu idwaliro twakutegeka bakukebera pressure bwebe eri waigulu bakuwa treatment pressure ike malo ofuna olubuto because bo olufuna teri waigulu ejja kweyongera ku shootinga. Bw'obanga oli mu akawuka bakuwa idagala lyekaikana me wafuna olubuto. N'omwami basobola n'okumwa kyebeeta prep buti eriyo prep. Omukyala bw'abanga ali positive omwami ali negative omwami bamuwa idagala limuyambe aleme kufuna. Likewise yena yamira idagala eri mutangiro obutafuna kawuka. Bw'obanga oli mulere wa sukali twakuwa treatment sukali yeikaikana before you conceive. Ebyo nebikwamba okuba ni successful pregnancy. So preconception care. Then bw'oba ofunye olubuto era olwisi lwida bagyeta accident oba chance nti lwidye ida fantinento ale boida fantinento oba screened ena could not abantu batamu categories nti onali high risk onali low risk. High risk kitegeeza ki nti alina ku complications by the way buli mukazi ali lubuto mulwaire olubuto is a sickness ongira mu idwaliro toli kutambula within 1 hour bakuba tyabisaawa abakufa. So ali olubuto yena aba mulwaire aye eri yaba bali ng'already bo balina complications edindi. For example bwebabanga bakulongoosaako already oli ku ni risk tolinga bayina abandi. Bw'obanga wazaala kuko omwana wamuniga ino yafa. Bw'obanga wazaala wa bleeding ino kuba ekyo kiyiraganamu. So about to be at a high risk. So when you come fantinento, twakoba either low risk or high risk. But boli high risk yeyo twaji document kandi continental card yo. So that buli yoja chiri people prepare for that. So antenatal care. Then hospital delivery. Bantu banji baida madwaliro fantinento babitira botuko okuzaala bajja wa kerementina olumulemero kayiba muiza ko tontina abanga wano mbuye mwamo ko batana bajja mulongosa ko mwana yaleta kabina yajiire ere balaba ejjo okukyusa. So hospital delivery amadwaliro gefe galina ebizibu tubidi bulungi bingi abasawo balina empisembi bavuma bakolaki tuligezaako okubitereza mpola. But whatever the case, idwaliro erimu abayombi abavumi eriza mu byakukola still liri better than okujja ew'omu na kyalo atayidi kuzaalisa ajogema mu musaayi gwo asalise ebintu omwana olwisi mama alina hepatitis B alina akawuka asalise buli kyayenda then omwana alwale. So still kiri better. Aye tu acknowledging nti tulina ebizibu madwaliro byetuligezaako okukola ku mpola. Then bw'omala okuzaala mu idwaliro eriyo kyetweta postnatal care ira tukwekebedde kuba complications ed'olubuto diwaga after 6 weeks So era twongera okukebera paka 6 weeks bwe baayo ekiriwo kyona tukiidandabe ku 6 weeks nibo enda family planning method wagifuna ekyo kyenenza okwogera ku maternal death kyetuliiko ba ku family planning method of choice bw'otuuka okufuna olubuto either for preconception counseling bw'olufuna either for antenatal care zaalira mu idwaliro and then either for postnatal care ebyo byenenza okusooka okwogerako then ndidi wana eri abajja obuuza ku infections ekyo ndi eri ajja okukibuuza soka nkyogere ku tibukaali. One time nali ndibona ku TikTok and someone said clean women are equal to infections. It sounded funny but it is very true. Nti infections dili mu bantu bayonda okusinga abatali bayonda ino. Now kye kiri kuleeta infection izedi takoma kuba abantu bali kwenda kuba bayonda ino. Birth canal ndoza tugitegera birth canal mutandogeza gynecology language nga ndi mu community but the vagina is the birth canal. Katonda yagitonda ngeri na mechanism yayo egikirininga and it is acidic. Kyovu empaledo diyuzika wagati wano ilimu acid. Now acid yoyo na keeping infections na yambo kusala ku infections. Aye eriyo obuwuka obumuleta acid yoyo babweta lactobacilli. Now ensonga diri ibiri lwaki abantu bafuna infections eri takoma. Of course kiri mu bakyala bakali bato. One, kwenda kuba kilini ino deni batandika emizeji taliwo kunaba ati kunabisa dito ati kodi detoxing ati kodi tire kindi chichi steaming Now ebyo bwobikola byona no kunabere munda no yuwa ya amadi oli kusimula yobuuka Katonda bwe yatayo bwobusimula then acid yawayo main infection is daida. Era category indi ya kumira ino idagala kuba bakuwandikira ku sifikizimu na bichi wajanga togula buli lunaku buli so bwogula eidagala ero lituka time lya cleaninga ni lactobacilli. Many wafuna recurrent infections. Kino kiri very common buli woja notyama mu idwaliro tovaawo nga tobona alikwa infections dinsumbwa and that is the problem. Now treatment eri etya ekisooka it is to stop echa risk factor. If idagala boidanga olina UTI nitukuwandikira nti mirasphyxism naku 3 oba doxycycline naku 7 eyo ni dose eri full kaito yongerawo. So bwobanga obe n'omuzogo gukujanga bwo window shopping idagala lekera bobo ina those practices edena kudino direkere. Usually abantu mbakoba nti vaginal health oba cleaning wetaga kye wakolanga toli musiniya 1 kuba abasinga babitandikira musiniya 2 siniya 1 nibo wajja madoro ga second musiniya 1 wezira infections dili musiniya 2 3 likewise boja mu byalo toyaganayo infections dili mu town kuba abantu balina access ku idagala balina sente bagula babona bukede bagula buli kintu. Sorry mentioning some media, but I watch these things ku bukede anyway. So you stop those things. Then treatment, if someone is interested, eriyo abalwalanga mambuluga babasiganga GV paint ku mambuluga. Yes, bululu. Bamwetanga bululu. But I think that's potassium permanganate. So okoze somewhere noyo once a week for 80 weeks. Again, okoze somewhere noyo gwe wesiga once a week lulala muna ku 7 for 80 weeks. Kumala miezi ebiri ngayi mu week wesiga mu mulundi mulala. Osiga mu birth canal infection. maybe kyensobola okwidukiza abantu nti bangi bakoba ati bw'okozesa garlic n'osonsekayo garlic infection lijja ati bw'otaayo yogurt infection lijja because garlic yali mu acid ne yogurt muli mu acid so ligeza kutaayo acid yali artificial. Okay, now ndibona ku ekyo ndowooza kiwaire question is denied. Then kandogere ku cancer ekasinze okuyita abakazi. Cancer eyo ni cancer y'omunwa gw'abaana, cancer of the cervix. Kiswaza nti cancer of the cervix ni cancer gye twidye ekigireeta, twidye okugikebera n'okugikebera kwangu kuba omunwa gw'abaana tiguli wala, tiguli ngere mu byendere mu ovary, guli kumpi awo. Twidye okukuwa treatment yewonya. By the way, cancer of the cervix yewona ng'ofunye treatment entuufu ewona. Aye ne kasinze kuyita abakazi yeti twidi ebigireeta okudiagnosis twidi treatment aye ne kasinze kuyita abakazi. Why? Abandi tuliroba abaana baife okuba wa vaccine ya HPV kuba HPV kawuka nakaleta cancer eyo. Aye akawuka kano kalina basaada kali kusikurota mu ya musaada neri ku HPV abakazi kayi bo bakazira. So abaana abakali okuba exposed to sexual relationships tulikubagema. Tulowooza nti mu Uganda myaka oti 10 years and below abakali aba exposed bali kuba wa vaccine eyo. Then ababaire exposed you keep screening lulala mu myaka esatu. Is that too much? Aye abantu baidanga kansa emuliire nga ni sign zabayire naddo. So screening for cancer of the cervix. Screening kitegeeza nti eza kiri kukulumayo ogire bakebere ku babone kuba yo etambula mpola etambula mu myaka oti 10 ku 15. So mu screening bwe bajagana mu cancer ya cervix ewona. Aye ewonera ku Cancer Institute TV no bandagende mu cancer ya nabaana bantole mu nabaana abajoji kutoola mu nabajo okuleeta ebizibu because bweba eswise some stage nibajo okugitoolamu mu kugimanipulating ambu kutoolamu kayi cancer yongera kola ki kutambula. That is 1. 2 balaba jocha n'amasanyalaze bakozesa munwa gwana baana ogwo to locate the points wabe bakuba amasanyalaze so lebo aja n'atoola mu nabaana eyo bayira mu kuteebereza. Nfuna amasimu mangi elo banko byati ndi mu kasa n'abaana otolera mu nabaana sente imeka nali kugyeta nvunza. So ekyo kya cancer of the cervix. Ere cancer yindi yaibere aye yo at least taita inonga cancer of the cervix. Then nja kusembyayo na kya fertility days kyendi kyonna bajja kukimbuuza omuntu atoola lyo olubuto. Olunaku omukyala lwatandika period side n'olunaku omwezi ogw'omubiri gwe gutandika. Omwezi ogw'omubiri ogw'omukazi gwandawulo ku mwezi ogwa kalenda era gwandawulo ku mwezi guno. So the day you start your periods is the same day omwezi gwe gutandika. Omusaayi ogw'omwezi ogubise guli kuvaamu ng'amagi ag'omwezi oguli kwirako gali kutandika okukula. So lwe tukozesa okubala fertility days. So omuntu aconceiving between day 12 and day 16, from day 12 to day 16. Ng'oli kozesa olunaku lw'otandise periods nti n'olusooka. So kuva ku lunaku olw'ekumi paka ku lw'ekumi is those are the fertile days. N'atali kwenda kutoola lubuto, those are the dangerous days. Yeah, they are dangerous. Ali kwenda adeeta fertile. Ekyo kyembeire ebyo byembeire nabyo to share with you. I think we can go into the questions. Nsobola okwogera the whole day niiduzi because these are topics, but I want to benefit you and also to pass on the information. So we can take the questions. Yes. Yes, ayina ekibuuzo golola omukono ate ndowooza kye babuuza kye tuwiramu kuba tuwida kubyerabira. Amina.
Ekibuuzo kyange kiri nti anti okobye nti abakazi abasoga tulina omusaayi mutono, ki ekireetera ekyo?
Tuli baavu, titulya bulungi, tulabirira ino abasaada, so buli kirungi okiwa musaada iwe okiwa musaada n'abaana niwe osembayo okulya. Tulya ino emereza mu nutritional value, tulina malaria mungi. Abaana batandika okukozesebwa nga bakaali bato, so they are stunted. Tulemye ebikado is part of the problem.
Yes, mukama waffe yeebazibwe.
Amen.
Nize papa babuwenge ntalina okubona abakazi abazaire abaana 6 abandi 4 zana ndyabenze ku mbafuni nkole ntya?
Nze tibeegombera ku irala. Now, omukazi okuzaala abalongo is a mistake. Yes, eba mistake okuzaala ababiri. Era ife tugyeta risky pregnancy. For your information, okuzaala abalongo kiri muku genes. Aye da mukazi donka. Omusaada aza contribution mu kuzaala abalongo. Mukazi nazaala abalongo. Because omukazi nasobola okuleeta ejirala liye yawulamu oba naleeta abiri. Omusaada always aleta billions of sperms. Always. So men are generous from birth. Women are mean from birth. Anyway, that off. Ekiri kuleetera abakazi na kulina okuzaala abaana abangi. Lwakumira makerenda gasembeza maji nga tibageetaaga. Olwolumala ku myezi 2-3 mu bufumbo mutali kutola lubuto ati oba amaji gali wala ng'alyagula mpeke dino ng'adimira. Kyokka nga amaji gazira buzibu. So olumira empeke dino direeta amaji 4 omulundi mulala. Now buli mwana gwoyongera ku lubuto lwolina adabulinga complications dojo okufuna. Era azaira abaana tasobola kumalayo myezi 9. Azaira omukaaga tasobola kutusa myezi 8 nga bajja mu incubator. Aidagali yetu bawa caffeine dozi ya mitwalo 3. Buli mwana alifuna dozi ya caffeine. Buli mwana ayitaga mitwalo 15 buli lunaku kumala emyezi 2. Buli ali nabo kyova obuno omuntu anirira aye ali ku TV ati ali kwetaaga buyambi bali mu banda biiro because yalina sente edigula empeke dino. So ekintu ekyokusembeza amaji mukirekera abalina obukugumu fertility okukikozesa. N'abandi bagamira baafa galeeta amaadi mu ndoto olina kansa and then you die. Kaya ekikuyise kintu kitono. Ifo okuba nti omukazi alemereirwa nti kapo bayiza etapa omukazi azaala eba kapo nti kapo eremereirwa okuconceivinga bw'oba olina emyaka 35 and below ng'ogezizaako omwaka mulamba kuba okuzaala ti kwangu ng'abantu bwe balowooza. So ng'ogezizaako omwaka mulamba nga toli kulufu name twakuba nti olemereirwa. Bw'oba oli abavu myaka 35 ng'ogezizaako emyezi 6. Lwaki owa 35 lwaki abavu 35 muwa myezi 6? Because amajigi gaba gakendeire mu mubiri so titwenda kulwawo ino ku interveninga. So muganda ngenze kyenda balongo mbatya kubandi ebizibu ebiyidirako.
Mukama yeebazibwe.
Amen.
Nange nina ekibuuzo. Wobanga bakulongoosa olimenti kukoma ku biso bimeka? Kubanga mpulira abamu basooka nti 4 ate 6. So njagadde otuwabule mukomo ekyo.
Kuzira ku kikomo. Eriyo Dr. Gwendi gwe balongoosa obusa 12 nga ali kunoonya mwana mulenzi paka lwe yamufuna. So kizira ku kikomo ayo olina okuba organized. Ekikomo dokita wona suggestinga nakoba ati muna n'abaana yona bwine ngambi ino olwira kweyinza okwabika n'aliteesisa nti koma kiba kiteeso aye zira iteeka nti alina akoma ku baana bati kizirayo. Era bwe tubonanga n'abaana mbi ino nga yasense mu kooti mukeeko oba eyabiike tumala gagitoolamu. Eriyo omulwaire gw'obonanga okumutoolamu n'abaana kisingayo okuba nayo nga azaalira ku kasaayi buli lweida eidanga teyabiikeku akatundu. But still eyo discussion eteekingibwa decision bakugu mu idwaliro taba na muntu mala okugitekinga eba timu namba okudiscuss ngani bakwati eno nabane yabika ino tutajikuba biwero kulu nolwira kweyinza kumuyita buyite. So at least bantu bana naba bakutebo meni bategeragana nti kusinza kuche tuli kubona putting everything together nabane eno kevemu olwo obulamu obw'omukazi ono so ezira kikomo kubana muntu bazaala dokita wona suggestinga kukyabwe ine. Yes.
Amanya gange nze Kiza Juliet. Ekibuzo kyembuuza waliwo wano kufuna olubuto ng'ofunye olubuto waliwo oli okugenda ku antenatal agenda okutuuka okuzaala nga ekitabo kya antenatal kyegamu kiweddeko naye ate ne wabeerawo n'oli n'agamba nti nze antenatal ne bwe ngenda emirundi 3-4 ki ekiyinza okuba nga kireetera oyo okuba nga ye agenda like frequently okubeera nga agenda munyonyonyo mu ddwaliro ate olina abanga tagenda buzibu ki obuyinza obuleeta ekyo?
Neyanziza antenatal care is every after a month, every after 4 weeks olimenti okuida neri iteeka lityo bwe liri because every after a month tukuwa fansida twakuwa kalushamu okukebera omwana ali kukula atya aye eri abantu abana high risk bendogaire kubale pressure eri waigulu sukali ali waigulu so alina okuida every after 2 weeks mukebere pressure mukebere sukali tukyusemu kwedagala tukendezeku tuongereku wano like that era actually eba alternative kumu admittinga mu idwaliro nabo bebako bangati bamugemereyo paka lwalizaala sometimes abalwaire banji ate odishe kitegeeza wakanga omukulu azirayo so wakuboti if you a patient keeping a appointment then you can be coming every after a week mukifo kyokusula mu idwaliro so usually such a patient have a story of course mu ethics tunachotweta confidentiality tijja akobera bizibu bya mulwaire ole butimwe mbaye mubani muwaya bye mu saluni weya but when there is a hidden reason emutwalayo every now and then.
Amaina nize Amriat Emmanuel.
Yes sir.
I have like 3 questions. Kibuze ekisooka
Yes.
What is the best safe planning method that one can use? Ezramu teidamu bonya
kantandike nekyo wanda kwerabira safest method for anyone ezirayo it depends on the person in front of you. Now these are my general statements. Abantu abali wano couples ediri wano nsuubira nti all the men are understanding so tisuubira mukazi kujja for family planning mukwekwekerera empiso umbi kyeki gimaking okuba ekibi 1 bwogifuna okumala omwaka mulamba ekunuunamu omusokono boni maro edamu ebituli empiso 2 bw'oyiramu okwenda okuzaala oyinza okumala emyaka 5 nga toli kutoola lubuto ngaye buli kyetukebera kiri nomo aye yamba abakazi abali mu bad marriages ng'omusada tayenda family ekyo ko omukazi alizaala buli mwaka sajja bamukuba akapiso kebatabone so abo bonka bempagira ku mpiso so yo tijenda as an obstetrician. Now family planning eri mu hormone nga akaweta nga capsules n'empiso yene omulwaire wa pressure obanga wafuna ku pressure ng'oli lubuto oba olina sukali oba olina ekirwaire ekyensigo oba olina ekirwaire ekyekibumba togikozesa capsules tokozesa mpiso ebyo bye mukobambo bampime method enjamu ezira kupima. It's about taking history then wabona ki omuntu kyasobola okozesa. So hormonal method n'omukazi omuna Uganda omuna Africa ali above 35 takozesa pills dongera ku risk ya blood clot. Mistake yetwakolanga government ya kuyikiriza abantu kujanga kugula ku drug shops nali kubitunda tabitegeera yolumuwa sente nga kuwa buwe. Copper IUD is a good one. I need hormonal IUD. Eriyo kai IUD eri mu hormone. Yo ekirungi ekigiriku nti on top of preventing pregnancy kaye preventinga n'endwaire edindi 7 preventinga cancer wana baana preventinga infections preventinga endometriosis preventinga fibroids endwaire edindi 7 ere IUD ya hormone seri mu hormone ayi hormone eyo idagala so kyenjendako aye bobanga ebyo ti nsonga ino yoli tamu akakopa. Okay.
Kibuzo kyange ekindi assuming couple erina career musobola mutya okwewala
erina career basikila
actually career actually bijja ku namba yogereku ku bintu nga bibiri couple erina career bombi wabayo ne couple erina sikira bombi naye kansooke ku bisaawo kino kya career. How can you avoid okuzaala omwana nga tali career oba tali sikira? Is there any treatment yo couple gyesobola okwesa nezaala omwana nga ali nomo?
Treatment yezirayo career ali kutegeeza nti nga bazaireyo omwana ali mu kwa kasaayi ka sickle cell. Now omwana bwaba mu kwa kasaayi ka sickle cell kitegeeza nti kubazaire ababiri kuliku ali namu kwa kasaayi katono aka sickle cell kubabiri kyekitegeeza owundi asobola okuba nga ali okay aye again bombi basobola okuba mu kuna akatono kyona kisoboka. Omwana bwaba tali career talwala tibwe kiri aba ali okay ni wano about 29% kuimwe abali awo muli ba career aye timukebera so timuidi so gene eyo mu Busoga region ni Mulango eriyo ino ni Muteso by the way mu southwest eri once so career ekikulu kya career kyakutegeera nti oli career so that ngojja okufuna omukazi bamukebera wa making sure nti omukazi gwofuna ali nomo azirira mu kuirala waire so that mu baana bemulizaala 50% bali banomo then abandi bali bamu ku career. Yes, being a career is by the being a career is okay. Career malaria tamusumbuwa. Talwala so no yaba umuze malaria mulwala bichi ebyo kumbe kala katona akalimu akasiko sero kayina akamprotectinga. So kuife tichi yagaza bwo ko bambo malaria takusumbwa. So being a career is okay. It's just umuntu oyo kutegera nti career tembwe tukefuna partner yano ni azira atali career. So that eliminating possibility yo kuzaala omwana alina muku ali sikla. Now family bwezaala omwana ali sikla kitegeeza nti baba career ni mama career amba mazo okwetestinga mwembi. Now oyinza okwagana nti mu bantu bana ababiri eriyo alina ku relative we sikira yalowooza mbo yo nayaleeta no mwembi mulina kasa mwana abakaria mwembi mulina so omwana ono yafuna kajini akabyo okuva ye mama na akabyo okuva ye baba na ali anilake. Yes, so eza musobola kukola osababu akatonda because it's always probability ekizibu ekiriwo nti bad genes always nangu ino da transmittinga than good genes. Baba bwabo omuyibi nazaala abaana 10 omunana bajja kuba bayibi babiri nabacho so bad genes always are easily passed on. Yes,
kibuzo kyange ekisembayo abakyala omukyala nga ali lubuto nga atambulira mu ino infections, how can you avoid it?
Now omukyala bwaba lubuto omwana gwalina munda is a foreign body ti mubiri gwe yenka. Now katonda yatutonda nti buli foreign body tulina okujja experiencing eve mu efulume. Now omukazi oyo okukalinga olubuto successfully omubiri gwe gulina okuyisa immunity guleme kusensinga nti wano waliwo omulabe so omwana osobola omukalinga mu kukola ekyo immunity around the genitals ekendera so infection is debafuna to data opportunistic infections kuba immunity eriro so obuwuka buno bwakulanga candida kuba candida no flora mu bakazi abakazi bona balina candida ayo omubiri gumu containinga na bwatola olubuto mbindi gunafuwa byatandika okuida so bwamala okuzaala na regain immunity ye byaja eri abatono abalirake nti tibibasumbuwa aye abasinga bibasumbuwa. So even then when they are pregnant, treatment gye tumuweba yakuwewezaku paka lwalizaala mena aboke.
Yanziza musawo nze kyandi kubuuzaako mpulire ng'oyogera ku safe days ne dangerous days. Waliwo some women nga bo bwalwala guno next month abalwala gule yalwala. So abalata those safe days.
Mwezi kigwolikova olikuva gwa kalenda
ogwa menstrual.
So anti boli ku comparinga n'ogwa kalenda kyoko mbo yabuuka mu guno guli gwali kubuuka. But this is what happens. Omwezi ogugwo gutandika lwotandise periods. Era gwakoma lwotandise periods. Lwotandise markinga end of the previous month and beginning of the new month. Now, abantu abandi bana periods zitandika omwezi gwebe gwa 24 days. Abandi gwa 36 days. So abasinga bali mu range eyo. Aye banji bali 28 na baba jani guno omwezi ogwa kalenda. So oyagana olinga ye abona period sibuli luvainuma lwa 24 days. Oyo kitegeeza nti bwalwala nga guno omwezi guli kutandika. Kai kwa 25 omwezi gwe n'ogwo gwa kalenda ajja kuyiramu. But as long as it is consistent ngali kulwala nga after 24 days it is okay. Now over 36 days kitegeeza ki bwalwala guno nga guwaku mwiki esembayo ajja kubuuka oguyira kwa yalwale mugule aye yena ali nomo kasa gubanga trend eri okay. To cover those fertile days or the bala kutandika lova tandise periods then from day 12 to day 16. Chova fetu kosala otandise periods luonka tituogera ku luomaze mwere amala mu wiki namba na ku 5 ebyo isenane issue firu otandise lwetubala.
Yes, yebazwe.
Amen.
Nyomusawo. Nze kyembuuza oyogedde ku family. Waliwo ababeera mu family n'alwamu ne waba tannalwamu naye waagivaamu alwawo ofuna olubuto oluusi n'obutafuna. What could be that?
Kyova nze kiyenda mpiso nesinga kuleeta ebyo kuba omuntu aba mu family yavaamu olubuto lwabula buli kyemukebera nga kirinomu. Now olebwa abatali kufuna lubuto tandikira ku definition tukube nti if you're 35 and below it is 1 year ngomaze mwaka mulamba having regular sex every month but you're not conceiving. Bwebanga omusaada ali wala long distance relationship targeted days detwogaire ku day 12 to day 16 mirundi 12 12 before you start labeling yourself mutiri kuzaala. So bwaba toli kulufuna then we investigate amaji tigali kukula oba tubes does baso age limiting sperms nebyo bibye tukebera bwebanga eri ekitali okay then we manage that. However empiso abafuni empiso byona bino bisobola okuba nomo ngayo mwana tali kuida paka yene yerowooza ne kusimulula so what gender.
Musawo kibuuzo kyange kiriwo ekiti omukazi bw'aba afuna olubuto ng'omwana buli gwafuna afaamu kiva ku kyekyo
bakyeta nabuguma mu busoga nti olina nabuguma nabaana ebuguma ekyo esindika omwana yavaamu. But in medicine tukyeta recurrent pregnancy loss nti embuto diri kwiragana ku wedivaamu. Ekibuuzo ekisooka nti diri kuvaamu ku myezi emeka mu myezi egisooka 3 mugiira ku 3 obanga gikuze bwegiba mugisooka 3 there are about 3 causes. One kubanga omukyalo ono mu first 3 months nga placenta ekali kuforminga azira hormones di mumala to support the pregnancy so tulina okugisupportinga with the additional progesterone. Then eri aba abakyala nga emibiri gyaibwe immunity esigala waigulu bwe baconceiving tekulinga down so yasindika omwana aveemu detweta autoimmune disorders antiphospholipid antibody syndrome then SLE abo tubaidandaba with the aspirin nga bafunye olubuto. Then kire ekindi oluisi omuntu mukumu naza munda nga maybe aliva mu lubuto due to other causes bamunaza munda naba cervix bagikosa then datandika okufanga mugani cervix enough abo cervix tugisiba when they are pregnant twagisimula nga natera okuzaala. So we individualize the patients. Toja ponti onalinga ole buli muntu aba na issues dedandawulo dolina okuwuliza bulungi, you investigate and manage. Mbimazeeyo.
Mukama yebazibwe.
Amina.
Nze mba ntamuwande Esther nviirire Buyengo. Ekibuuzo ekyange kiri nti abakyala abandi omuntu nga afunye olubuto kidda kitya okuba nga afunye olubuto ate ne banga munda muzira mwana mu lubuto omwo banga oba is outside the womb.
Bibiri olikuba ectopic pregnancy oba ndyetakula ectopic
tekidyawo mu Lusongo.
So ng'olaafunye olubuto aye omwana tali wa alimenti kuba ali kuliya kwa nabaana kyolibuuza
n'awandi nga alimu aye nga yalemerwa okudevelopinga munda.
Okay, aye ebyo byandawulo. So ectopic pregnancies now ekimu ku bibireeta hormonal family planning methods they increase a risk for ectopic pregnancies. Kyo kituufu. Aye ife mu public health tubona ku bantu 10 Bameka abasobola okola ki okifuna about 2. Singa oba omize emergency pills morning pills because it is a high level of progesterone n'obumira me Katonda n'akuvaamu n'ogifuna because method eno eremesa age okwida okumeetinga ni spam. Now age bwejja nili meetinga ni spam idukira method eri kulemesa entambula so omwana akulira yebi meeting ire so always ever accident. So it increases risk but not so much to send it to dikozese. 2 infection is edena kudino PID waba nenkovu mu nseke so age ri alemerwa okutambula obulungi. So ife nga abasawo this is what we do. Bobanga obere family planning method men ofuna olubuto tulina okola scan mize gisokesa tubone luliwa. Yes. Chova wetaaga omuntu akutegeera ti bintu byakujja ku drug shop wagemlola kino. You need someone who follows your story. Okay. Yafuni olubuto ngali mu IUD tukole scan luliwa. Ntya luliwa element okuba kizoke. Kizira buzibu ka bwana azala tulikatola muzeni.
Masawo.
It can fail. Eli alikwewunya it can fail. Yes.
Yes, yes, baba Luganda. Mbe nso yogera ku ebintu biri ekisooka. Rhesus factor. Kubanga mpula nti if your partner is I think negative and you're negative. Abana bemuzala emutodivanga mbuve ekyokubiri. Kikya kiretera olubuto munda nga tulikula. Neyanziza ino.
Mwino kyabuuza mbe tekiyizeemu. Now, age eri omusaada limitinga n'eri omukazi. Then yenkwaso actually enkwaso ey'omusaada neyingira mu age eri omukazi. That's how fertilization occurs. Now, always age eri omukazi liida nga lizira mu nina. So age eri omukazi bw'eliida nga lizira mu nina. You will conceive aye omwana taakule. Why are you going to conceive? Because the gene for implantation is carried by the man. Omukazi ejiri mubita mu buli mwezi lyajja buji. Lwaki kulu no limala lyajja lyegema lyatandika okumera. Because the gene ekola order anti ejiri mere musaada n'aba nayo. So kasa ejiri bali meeting the sperm lijja kugezaako okumera aitirikule because liri kulakinga part ya mama. Ero debeta oblated ovum and embryonic pregnancies. Yes. Now, rhesus factor. One of the things chetukola toli lubuto is blood group. I am blood group chetuli kuendamu is rhesus factor. Ekyo kuba ati B positive, B negative. Abantu abasenga bali positive. Now, mama bobanga oli negative. Baba naba positive. Omwana gwoji okufuna ajja kuba positive. Positive neri strong. Sa ajja kujana ya baba eri positive. Buti we negative mama olina positive baby. Omwana asoko ojja muzaala bulungi. Katonda endabwe etavwa mubuvwe. No osobola omuzaala bulungi. Aye mukumuzaala omusayi gwa mama n'ogwa placenta ere ya baby gujja mikisinga. ogw'amaama ndi gubone nga gule gulimu abajasi begutategeera gwona gwetegeke okwataakinga enda jojo okwiramu okufuna nadijjo okuvangamu. So kyetukola tukukebera blood group, then bw'otuuka ku 28 weeks, between 28 and 36, twakukuba empiso eprotectinga singa omusali gukurosinga ng'onaatera okuzaala gwaba neutralized. Niba omala okuzaala within 72 hours twakuwa empiso eyindi eri around emitwalo 18. Aye empiso eyo gye tukukuba eri protectinga mwana ajja kuyira ku tyono gw'oli kuzaala leero. Now bw'oba tooli lubuto buli mulundi gw'obuliidinga kwolina okufuna empiso eyo, so it becomes expensive. Aye ekyo kye weetaaga okutegeera n'okwetegekera.
Mukama yeebazibwa b'olukanda.
Amiina.
Njagala kwogerako ku waliwo gundi waliwo kapa abuuziza nti lwaki omuntu afuna olubuto n'abeera ng'avaavaamu buli kaseera. Dr. kyozeemu kituufu naye njagala kwongerako katono like nga woogambye nti mukola investigations to find out lwaki omuntu oyo avaavaamu lubuto. Kapa abuuziza ekyo okuvaavaamu lubuto can also be caused by infections nga we tulabye mabeega eyo. Then the other thing may be fibroids. Webeera fibroids ng'eri ku n'abaana automatically waliwo fibroids nga nnene ng'omwana tasobola kukuliramu might bring that cause of frequent abortions or miscarriages. Nebirala Dr. nga wagambye. Thank you.
Uncle is saying nti myezi 3, so he restricted my discussion. But true infection is syphilis and the others like CMV, though they are not very common, especially the CMVs. Syphilis go tulina ino. Aye abantu abazanisa ino pets obupusi which they can get those infections. Fibroids just below the endometrium donor, they can push out the baby, especially if they are bigger than 5 centimeters. Mbele tianza kudogera fibroids because people are over operating on women unnecessarily. Oli mu fibroid, oli mu ngate jali na it is innocent. So I just decided to
quit it. Ndekirala waliwo kapo mulala ayogedde ku infections in pregnancy. I think I'm forgetting the question.
How do you prevent the recurrent infections in pregnancy?
In pregnancy. Dr. nga wagambye kituufu naye also wolaba after even this mother has given birth nga still she's carrying infections, you can treat partner. Mostly balwadde bano bajja mu ddwalirozi naye omuntu basajja, I'm sorry to talk about you all, but basajja don't want to treat infections. So this lady here keeps on getting frequent infection from frequent infections because afuna adamu nafuna ku musajja we. Adamu ye bamujanjaba naye ate musajja akomawo ate namuwa najanjaba oluusi n'agamba nze bamaze okunjanjaba ekintu kino mirundi mingi siri kuwona. Naye the partner is not treating this thing, so these things are good to treat both partners. That is why they call it partner notification or partner treatment.
Kama yebazibwe.
Amina.
Doctor, thank you. I cannot put it in Lusoga. Let me speak English. I just want to know from you, doctor. You talked about people living with HIV when they are given treatment or drugs. Why do they develop their stomach? Why do their stomach becomes big as if somebody is pregnant? Help me to understand that. Thank you.
People know ARV is gaining weight. Yes, I remember earlier we used to have stavudine one of the ARVs that could make people fat and get that funny figure. But these days, the ARVs are not causing those changes. It was causing fat deposition in parts of the body where they shouldn't be fat. About the stomach, I may not answer, but usually in such situations, we look at that particular patient. There could be other conditions in that patient. For example, liver disease, giving you ascites and... but it's not documented as a general complication of one of the ARVs. I'm done. Thank you very much. I did not want to talk about men causing infections, because it is number 4. It is true, it is there, but a woman can give herself infections. But men, we almost always get it from women. So this is what happens. The body has what we call normal flora. Every part of the body has organisms that protect it. But the normal flora in the armpit is different from the normal flora in the eyes. So when you put a hank in the armpit and then you bring to the eyes, you get a sty, because you've moved the infection from the armpit to the eyes. Now the distance between the anal opening, the anus and the vagina is 4 centimeters. So infection can move from the anal part to the vaginal part and give you infections. If you go to a senior 4 class and ask what is a UTI, 90% of the girls know. 90% of the boys don't know. Even the few who know, they have girlfriends, so they had. So naturally, a woman can give herself infection when there is no man involved. But a man almost always gets from a woman. Now, how a man comes in is getting what would be known foreign from the anal parts, getting from the vagina and taking to another vagina. So that's how a man comes in. But it's like number 4 in causing recurrent infections. Why I kept quiet? Always men are the culprit. Women come saying, "Kumbe, she's getting her own thing." The man sometimes even comes go back alone and says, so that's why I wanted to. So please, you should note that yes, a man, and when a man is sick, we must treat the woman, because we're almost sure that he got it from the woman. But if a woman is sick and the man is okay, especially if the woman has a risk factor like a pregnancy, there is a discussion, by the way. Say, maybe she has not yet given him. Especially if you have the money talk and he says, for me it is only her. Then you say, probably doesn't even need. But it is true, especially in the environment where you're not very sure of the information you're getting. You treat both of them and wow. My time is up. Can I just answer hand then?
Doctor, nze ekibuuzo kyange kiri nti omukazi waba agire like in family planning yamala like 1 month waliwo abamala omwaka 2 years aye waba nga ali mu family planning, is it needed to go and look for they tell us that there is tablets for that, you can swallow then you go to the periods?
Eyo method eto bwebekola so bati wetaaga kai kunoonya mbobone ku periods. Aye boyda yetulinga oli kwenda abona ku musaayi, we can give you medicine kubona for your own comfort, but it is okay. That's how it works. Thank you very much. I beg to end there. Mbonamba ya simu 0777.
So abali kuandika simu abajetaaze yi.
Ayi banje abali nayo wano 0777 05 2680. I prefer WhatsApp 0777 05 2680.